The sinus infection typically includes symptoms of headache, facial pain and pressure, nasal congestion, decrease in sense of smell, and oftentimes yucky discharge from the nose. Sinus infections are not uncommon in the general population, so patients are generally expected to experience a sinus infection maybe once a year or once every other year. The people that need to come in and see an ENT doctor are those patients that have greater than 3 sinus infections per year, or patients that have had a sinus infection that has lasted for 3 months or greater. So if typical over-the-counter methods don't help resolve your sinus infection, there's lots of ways that we can help treat you here. Number 1, we try to exhaust all medicines, so we'll typically prescribe some medicated nasal sprays and some antibiotics. If for some reason, after several rounds of medical treatments, patients' sinus infections don't go away completely, then we're looking at some type of a procedure to help remediate the problem. Those procedures come in 2 flavors, minimally invasive techniques and maximally invasive techniques. Here at Capital ENT and Sinus Center, we try to focus on minimally invasive sinus techniques that are effective at treating sinus infections long-term so that we can get you back to normal living as quickly as possible. As a chronic sufferer from sinusitis, one might ask, what is the difference between a balloon sinuplasty and functional endoscopic sinus surgery? A balloon sinuplasty is a procedure that's typically done in the office, and it's more of a minimally invasive approach. The main premise behind balloon sinuplasty is it's a tissue preservation technique, so nothing is being removed from your nose. We're just trying to unblock your sinuses in the least invasive fashion as possible. With functional endoscopic sinus surgery, we typically only recommend that for patients who have failed more minimalistic approaches. Functional endoscopic sinus surgery generally involves full anesthesia, and it typically takes a lot longer than balloon sinuplasty. During functional endoscopic sinus surgery, it's not a tissue-preserving technique. What we're actually doing is removing some of the bone and soft tissue from the inside of your nose so we can really open up those sinus drainage pathways and allow them to flow adequately. If you've had long-term difficulties breathing through your nose, come see the nasal and sinus experts at Capital ENT and Sinus Center so we can help you achieve the nasal breathing that you're looking for.